Yeah, can you see this in the bottom corner? I'm going to move it. There we go. Okay, so this morning we're just going to do an introduction to the local offer and run through what the purpose of the local offer is and what it should do for families in Somerset. Okay, so just to start off, it's really important to understand that every single local authority, so every council within England, has a duty by law to publish a local offer on their website. So there is an expectation that that needs to be available for everybody in the area to be able to access. And we'll talk a little bit later on about how you can do that if you haven't got a website. Okay, so we'll just explain briefly what the local offer is. So the local offer that we're talking about today is actually the website local offer. So the term local offer can get used for two things. One, for the website itself, and two, to refer to the bigger local offer of what's available in Somerset for families. So we're focusing today on that actual website page. So the local offer has two main purposes. The first one is that it needs to provide clear, up-to-date, accessible and comprehensive information about what is actually available for children and young people who have SEND and their families, and also how you can access that. So it should include things like any costs. It should include things like the eligibility criteria. But the second reason that the local offer exists is also so that the provision that's available in a local area, so Somerset in our case, is more responsive to the needs. So, for example, if we had a lot of parents were searching for a particular service, just going to pick something, I don't know, ADHD support, we'll go with that. Then if lots of people were looking for it, then that should be telling the local authority that actually that's the area that they need to look at and to develop that service. So a bit more about what it is. So the local offer gives children, young people and their families information about what services are likely to be available in the area. It's important just to note that it isn't a guarantee that that particular service will be available, but it should give you a guide as to what you can expect. Now, the reason we say that is that obviously providers change, and we know over COVID people have, particularly some of the providers have gone, and obviously it's just about the fact that there is no guarantee, but it should be pretty accurate. The local offer needs to be available on the internet, which it is, and the local authority must also say how people without the internet can access the local offer. So if you don't have internet access, or you prefer not to use the internet, because you don't have to use the internet if you don't want to, then you are able to access the local offer through the contact centre at Somerset County Council. So what we all used to refer to as Somerset Direct. If you phone them, they can look information up for you, and they can also post it out to your house. You can also access it through places like the library. They can help you as well. What's really important, though, is that the local offer shouldn't just be a list of services. So it isn't just a directory that you go on and find out what's there. It should also give you information about support that's available. So it should help you to find things. For example, if you were looking for mental health service in Chard, you as a parent, we wouldn't necessarily know about a project called the Watch Programme that runs in Chard to help with mental health. So the local offer should have information pages that say, if you're looking for X, try this, this and this. And the information should be clear and it should be easy to find. I'm just going to very quickly talk about some of the terminology in the law that came out, basically, around which states that there has to be a duty for a local offer. So the actual law that insists that there is a local offer is the Children and Families Act, and that came out in 2014. There is also SEND Code of Practice, which some of you may have seen, and that is how to implement that legislation. So within that, there are lots of terms where it talks about musts and shoulds. And I think it's really important to understand the difference between the two. So if it's a must, then they have to do it. There is no choice. It's something that has to be done. that it's a statutory duty. If it's a should, then it should be basically, unless there's a very good reason for not doing it, it should be taking place as well. So with that in mind, the legislation states that the local authority, so Somerset County Council, must publish its local offer by placing it on their website. And they must publish the arrangements for how people can access it if they haven't got the internet, how different groups, including people with special educational needs and disabilities, can obtain a copy of the offer, and publish how those identified in paragraph which talked about earlier can provide feedback on the local offer. So when you go onto the local offer, which we will do in a little bit, you'll see that there is, on every page, there's a little feedback button, and that's all of those comments that come through must be answered, and they must also publish at least annually their responses to the feedback that they've received. And we do that in an annual report, and it's put into themes. So they don't literally put every single comment, but they'll say we've had comments about, say, information pages on EHCPs, and this is what we've done. They also have to talk about how it's been developed, how it's being reviewed, and how they've involved families. So at the moment, the local offer is just about to go into another phase of development. People have fed back that the search function isn't working very effectively. So there's a lot of work happening in the back office side of the local offer, which apparently is coding and all sorts of technical stuff, so we're not going to go into that. And that should make it much easier to find things using the search function. So there is rules about what has to be on there. Local authorities have to comply with a list of things that need to be published, and we're going to go into a little bit of detail, but they must include provision in its area, and they must also include provision outside of the area that they think that the local families will be using. So one of the things, for example, on Somerset's local offer is there is a page which takes you to all the local offers of the surrounding counties. Because if you live on the border, say, for example, you lived in Burnham-on-Sea, you might be using services from North Somerset because of just living over the border. So it's helpful to know what's available there as well. So these are some of the things that need to be included. So as you can see, it goes right across the span. It's education, social care and health. So there should be a list of all schools on there, including council schools and academies. There should also be independent schools. There is a document called Section 41, which is a list of government approved independent schools. So that a link to that should be on there. Information about pupil referral units, colleges and apprenticeships. Social care should include any eligibility for services, criteria to access it, how to transition into adult services, information like short breaks, respite, information from the community inclusion teams on there, and also information about childcare. There should be general information about SEND, so how SEND is identified in the area, what you should be able to expect from education. So you may or may not have heard of the term core standards, which is a set of documents which explain what schools should be providing. Any additional learning support, so things like music tuition, medical tuition, all of those things should be on there. There was also things like the catch-up programme that was run over the summer after COVID. All of that was on the local offer. There's also should be information about EHCPs, what they are, how to apply for them, what the process is, how to make sure that they're being implemented. All of that should be on the local offer. Another key feature that came in with the SEND reforms is around preparation for adulthood, and that there is a whole section on the local offer about that, and that should include education, so colleges and information about universities, work, housing, how you can volunteer, what support there is from transitioning from children's services into adult services, and things like internet safety, youth offending service, all those types of things should also be on there. And then from a health perspective, There should be information about personal health budgets, any therapies, any palliative care, any emergency care, the wheelchair services. So you can see there is a lot of information on there, and that it's should be all encompassing. So when the council are working on their local offer, they have a duty to consult across the whole of the age range. So they have to speak to children, young people and their families. So we've had some listening events this year to gather feedback on the local offer. We've also had an external research company come in and do a piece of work as well, where they've done interviews with families about how they use the local offer and how it can be improved. They should also talk to earlier settings, schools, post-16, so colleges, sixth forms, and health. So the clinical commissioning group who commissions services in Somerset, and also both of the hospital trusts. So there are some core principles around the local offer that have to be applied, and I think it's really important for us to understand these as parents. So one of them is that it needs to be collaborative. So they must be working with all of those groups that we just saw on the previous slide, in particular parents, children, young people. And they must also ensure that it is accessible. So it should be easy to understand, it should be factual, and it should be jargon free. So you should find on there lots of acronyms, for example. It should be in plain English, and it should be something that anybody can be able to read. It also should be well signposted and well publicised, which is an area we know in Somerset needs to be improved because there's still a lot of people who don't know about the local offer. It needs to be comprehensive. As a parent, you should be able to go on there and find what you need, is basically the short version. It should include who's eligible for a service so that you're not applying for a service that you're not going to be able to access, but also so that you know what you can access. It should be up to date. So you should find that there aren't services on there that have gone out of commission a couple of years ago, for example. And it should be very transparent about how decisions are being made and who's accountable and who's responsible for them. So as you can see, it's a massive project. It's a massive thing that needs to be done. And the only way that it's going to be done is if everybody works together to do it. So the council, the clinical commissioning group, people who provide services and families all need to work together to be able to make sure that the local offer is the best that it can be. So thank you. That's the end of the slides. I'm going to ask Rachel to stop the recording and then we can have a discussion and I'll take any questions.